Antimicrobial resistance, or AMR, is a silent threat to global health. It occurs when bacteria, viruses, fungi, and parasites evolve to resist the drugs designed to kill them. Just imagine, a world where a simple cut could lead to a life-threatening infection. The World Health Organization has identified AMR as one of the top 10 global health threats facing humanity. If left unaddressed, we risk entering a post-antibiotic era. In this scenario, common infections and minor injuries could once again become deadly. The discovery of antibiotics was one of the greatest medical achievements of the 20th century. However, the effectiveness of these life-saving drugs is waning. We must act now to preserve the efficacy of the antimicrobial drugs we have and to develop new ones for the future. The development of antimicrobial resistance is a natural evolutionary process. However, human actions have significantly accelerated this process. The misuse and overuse of antibiotics are major drivers of resistance. This includes the inappropriate prescription of antibiotics for viral infections, as well as their use in agriculture. In many parts of the world, antibiotics are readily available over the counter without a prescription. This easy access contributes to their misuse and fuels the rise of drug-resistant infections. The use of antibiotics in livestock and agriculture further exacerbates the problem. Pharmaceutical companies have been slow to invest in new antibiotics due to the high costs and relatively low returns on investment. We must incentivize the development of new antibiotics and promote responsible use to combat the growing threat of AMR. Antimicrobial resistance is a global health crisis. It affects every country and every person regardless of age, socioeconomic status, or geographical location. Low and middle-income countries often bear a disproportionate share of the burden. Drug-resistant infections are responsible for an estimated 700,000 deaths annually worldwide. Without immediate action, this number could rise to 10 million deaths per year by 2050. The economic impact of AMR is also significant. Unchecked, AMR could cost the global economy up to $100 trillion by 2050. Drug-resistant infections can spread through communities, food chains, and the environment. Addressing this global crisis requires international collaboration and a commitment to responsible antimicrobial use at all levels of society. The consequences of inaction in the face of antimicrobial resistance are dire. As drug-resistant infections become more prevalent, routine medical procedures such as surgeries, organ transplants, and cancer treatments will become increasingly risky. The success of these procedures relies heavily on effective antibiotics to prevent and treat infections. Imagine a world where a simple cut or a urinary tract infection could once again become life-threatening. The progress we've made in medicine and healthcare is at stake. Beyond healthcare, the rise of AMR has profound implications for food security and economic stability. The widespread use of antibiotics in agriculture could lead to the emergence of drug-resistant bacteria in our food supply. The projected economic losses due to AMR by 2050 could plunge millions into extreme poverty. The time to act is now, before the consequences of inaction become irreversible. Addressing the complex challenge of antimicrobial resistance requires a multifaceted approach. It demands a collaborative effort from governments, healthcare professionals, the agricultural industry, and the public. We must work together to preserve the effectiveness of existing antibiotics and to develop new ones for the future. One crucial step is to improve antibiotic stewardship. This involves promoting the responsible use of antibiotics and reducing unnecessary prescriptions. Government funding and public-private partnerships can help to bridge this gap and stimulate innovation. Educating the public about the importance of responsible antibiotic use is crucial in the fight against this global health crisis. The fight against antimicrobial resistance is a shared responsibility. It requires a united front and a commitment to action from all sectors of society. Individuals can make a difference by practicing good hygiene, getting vaccinated, and using antibiotics only as prescribed by a healthcare professional. We must also be advocates for change, urging policymakers to prioritize antimicrobial resistance and support efforts to combat this global threat. The future of healthcare, and indeed global health, depends on our collective action. The time for complacency is over. Let us rise to the challenge and work together to combat this silent threat before it's too late.